Hi Adya, my name is Monique. I'm going to be interviewing you for the new grad position. I've got 3 questions for you. Are you ready to proceed?
Yes.
Perfect. So, no 2 shifts are ever the same for a registered nurse. Consider how you deal with stress on busy shifts and have many competing demands. What impacts do your thoughts, emotions, and physical feelings have on your performance at work? And what are your responsibilities as a registered nurse, and what strategies will you employ to ensure professional practice?
Okay. I understand that nursing is a dynamic profession where priorities can change quickly. During a busy shift, I will remain calm by focusing on patient safety, prioritizing tasks based on clinical urgency, and communicating effectively with the multidisciplinary teams such as nurses, medical teams, and team leader. I recognize that stress can influence my thoughts, emotions, and physical well-being. For example, feeling overwhelmed or fatigued can affect my concentration, decision making, and communication if not managed appropriately. Being self-aware is important because recognizing these early signs can allow me to respond before they can impact the patient's care. As a future registered nurse, I have a professional responsibility to provide safe, evidence-based, person-centered care while practicing within the Nursing and Midwifery Board of Australia standards and New South Wales health policies. I am also responsible for recognizing my own limitations, escalating concerns, documentation, protecting patients' confidentiality, and advocating for my patients. To maintain professional practice during stressful situations, I prioritize workload using clinical judgments, communicate early when I need assistance, and participate in team handovers and use structured communication tools such as ISBA. I would also take short breaks when appropriate and to stay organized and reflect on challenging situations to identify opportunities for improvements. For example, during one clinical placement in an emergency ward, we had several deteriorating patients while we had new admissions that were arriving. My registered nurse and I prioritized patients using HG assessment, updated the team leader, and assisted my registered nurse wherever possible. Despite the busy environment, all patients received timely care because we communicated effectively and worked collaboratively as a team.
Okay, Adia, moving on to question 2. Mental health is a significant and emerging issue within clinical facilities and the community. If the patient or woman you are providing care for as a registered nurse experiences an episode of acute distress, what role do you think your position entails in ensuring the mental health of the patient or woman you are providing care for?
Okay. As a registered nurse, I believe my role is to provide compassionate, person-centered care while ensuring the intimate safety of a patient and those around them. If a patient experiences acute distress, I would first remain calm, introduce myself in an appropriate way, and assess the situation to identify any intermediate risks, including the risk of self-harm, harm to others, or deterioration in physical health. I would use therapeutic communication by actively listening, speaking in a calm and respectful manner, validating patients' feelings without making assumptions, and maintaining their own dignity throughout the interaction. I will also notify the senior staff promptly, escalate concerns accordingly to the hospital protocols, and collaborate with the multidisciplinary teams, including mental health clinicians if required. I will continue monitoring the patient's mental state, document assessments and interventions accurately, and involve the patient's family or carers where appropriate and with consent. I also recognize that physical and mental health are closely connected. Therefore, I would consider potential underlying causes of distress, such as pain, hypoxia, delirium, medication effects, or anxiety. Throughout the situation, I would advocate for the patient's needs, respect their autonomy where it was possible, and support recovery by promoting a safe, supportive, and non-judgmental environment.
Beautiful.
Thanks.
Okay, Adia, so the last question for today. How do the New South Wales core values of collaboration, openness, respect, and empowerment relate to your role as a registered nurse? Can you provide an example from your clinical experience?
Okay. The New South Wales Health core values are fundamental to safe, high-quality patient care. Collaboration means working effectively with patients, families, and the multidisciplinary team to achieve the best outcomes. Openness means honest communication, being receptive to feedback, and speaking about patient safety concerns. Respect means treating every patient with dignity, cultural sensitivity, compassion, while recognizing their individual preferences and values. Empowerment means supporting patients to participate in decisions about their care and encouraging colleagues through shared learning and professional development. An example from my clinical placement involved caring for an older patient following surgery who was very anxious about returning home. I collaborated with the physiotherapist, occupational therapist, social worker, and medical team to ensure discharge planning addressed the patient's concerns. I also maintain open communication by updating both the patient and my supervising registered nurse on progress. I also respected the patient's wishes by listening carefully to their concerns and involving their family with consent. In discussions, finally, I empowered the patient by providing education about mobility, medication, and follow-up appointments, encouraging them to ask questions and participate in planning their discharge. This overall experience has reinforced that applying the core values has led to better patient outcomes, stronger teamwork, and more person-centered care.
Brilliant answer, Adia. It was very lovely to meet you.
Thank you.
You'll hear back from us shortly.
Thank you.